How cold is too cold? The effect of seasonal temperature variation on risk of STEMI. Please proceed.
And she comes from an extremely cold city, I can tell you that.
Okay. Thank you for being here today, and thank you, chairpersons, for that lovely introduction. So my name is Shuangbo Liu, one of the adult cardiology residents from University of Manitoba. Today with my colleague, Dr. James Tam, we're going to be here talking about a project we've been working on. How cold is too cold? The effect of seasonal temperature variation on the risk of STEMI. So first, we'll start with some background information. We know from previous literature that there is a clear correlation between cold weather and heart attacks, as well as deaths related to it. Previous studies have shown that the incidence, as well as hospitalization for these heart attacks, or as we call them, acute MI, as well as cardiac deaths, are increased when the weather is colder. However, what we do not know is the relationship between weather and the risk of STEMI. So STEMI stands for ST segment elevation MI. It is the highest risk type of heart attack. It occurs usually due to an acute plaque rupture, which causes blockage in a coronary vessel. This can lead to very dramatic presentations, as well as a higher risk of death. So the objective of our study was to assess the relationship between cold weather. Specifically, we looked at temperature and snowfall. We want to assess that relationship between cold weather and STEMI in Winnipeg, Manitoba, Canada. So for those that do not know, Winnipeg is the capital of the province of Manitoba in Canada. Geographically, it's right in the center of North America. We typically have a humid continental climate with 4 very distinct and lovely seasons, although occasionally our winters can get quite cold, which has earned us the nickname of Winterpeg. So we performed a review of all patients with STEMI in Winnipeg from January 1st, 2009 to December 31st, 2014. We collected weather information from Environment Canada. So we looked at temperature, the daily high, the mean temperature, as well as the daily low. We also collected information about snowfall. We found a total of 1,817 STEMIs over the period of 6 years. So 6 years works out to 2,190 days. So that's almost one of these major STEMI heart attacks per day. The pie chart here shows the distribution of STEMI rates over temperature. So the blue represents less than 0 degrees Celsius. The red represents 0 to 20, and the green is greater than 20 degrees. And what we found was almost a perfect 1/3 distribution in each temperature group. This graph here looks at the average daily STEMI cases by month. So the blue bar graph, part of it, shows the daily STEMI rate distributed over the number of months for the 6-year period. And the black plotted line is the average daily high. And you can see that the rate of STEMI is higher in the months that are colder, in the winter months, and that there's an inverse relationship between this. So basically, the colder the weather, the more likely the chance of someone to have one of these types of heart attacks. We also looked at STEMI rate by daily high temperature. So what this graph just demonstrates is that when the STEMI rates are stratified by temperature group of 10 degrees, so less than 0, 0 to 10, 10 to 20, 20 to 30, and greater than 30 degrees. It shows a pretty linear relationship in terms of the rate of STEMI. So again, showing the point that the colder the weather, the higher the chance of a heart attack. So our conclusions from this. So there is a clear association between temperature and the rate of STEMI. In fact, for every 10 degrees colder, the risk of STEMI goes up by 7%. That's pretty significant. Based on our study, we also show that there's no detrimental effect of hot weather on the rate of STEMI. Previous literature have been variable about this, but at least at our center, in the climate that we have, there was no detrimental effect. So future directions for our study would include validation of these results, studies of looking at the mechanism of why this could be happening, as well as action to improve healthcare. Thank you.
Thank you, Dr. Liu, for this compelling presentation. We have now room for questions. Are there questions from the audience? Yes, please.
Catherine Desmoulins, Medscape France. Is there a cutting edge for the cold? How cold is cold?
Sorry, how cold is cold?
What kind of temperature? Because you show the line, but is there what is the average temperature? And
So-
when does it start to increase with the cold?
When does it start to increase with the cold? So I want to make sure that I understand your question correctly. So what we demonstrated is that when it's colder, so less than 0 degrees, the risk of STEMI is higher. So at that temperature, people should really be sort of aware and know that they have a higher chance of having a STEMI.
Do you mean the temperatures we're talking about are freezing temperatures?
Yes.
Yeah.
Okay.
Anything below 0, we can see the reduction in, or the increase in the risk. Any more questions from the audience? Yes, please.
Sarah Freeman, Cardiology News. You mentioned there at the end possible actions to kind of improve. What could you actually tell people to do then?
So that's a very good question. This was our thought-provoking study, so we would of course have to both look at this in other climates as well as do some prospective study in the future to confirm these results. But I think the important message would be for increased awareness in both at a general population level as well as for our health physicians, as well as increased preparedness for these events when they do happen.
We see this on television, these pollen warnings. Do you actually envisage we get cold weather, heart warnings also on television?
So I think perhaps that's something that we're moving towards too in the future, that if we have enough of these studies that prove that, this is a valid point, then perhaps when we do weather like forecasts, then we can add, the same thing as like an air quality index or a pollen index to add something like a temperature index for people with heart disease. But I think that that's in the future.
Any further questions?